My dad stopped breathing. My mother-in-law had to give him mouth-to-mouth.
Okay, take a nice deep breath for me, okay? You're doing really well.
Oh, my God. He's cold.
Is he changing colour?
Yes, he's very pale.
Okay, I'm organising that help for you now.
Dad, keep your eyes open. Oh, Dad.
Life response 99. We've got within the 8-year-old male with a heart rate in the low 20s.
Roger, thank you.
Mobile intensive care paramedic Cam is now on the way to the critically ill patient. He'll be providing specialised backup to the first ambulance crew, which has just arrived at the house.
Normal resting heart rate for somebody would be sort of 50 to 80 beats a minute, so it's not good.
When somebody's heart rate's that low, my biggest concern is that they'll lose consciousness, lose airway control, or even worse, they'll go into cardiac arrest and die.
Hey.
As Cam makes his way through the heavy traffic, there's an update from the crew. Cam's worst fear has been realised.
99 received in arrest.
So the patient's now gone into cardiac arrest. Right now, I know the guys on scene will be doing CPR. Without CPR, there's no blood pumping around the body, therefore there's no oxygen going to the brain, and eventually the brain will die. My biggest concern here is, are they going to be able to start his heart again?
It's been a big year for you.
It has been a big year for me, definitely.
Back on shift together are long-time friends Leonard and Nat. They're catching up on all the family news.
What's been happening with
With my man,
you and your man?
with Adrian.
Yeah.
We did move in together, so
Awesome.
it was good.
And now you got this kind of almost hybrid composite family.
Like this combined Brady Bunch. So now we've got 5 kids, 3 of mine, 2 of his. We've got 2 dogs, all in the one house. It's loud, it's noisy, and it's a lot of fun.
Is there room for maybe one more kid to
A
kind of...
6th child.
Well, to kind of, I suppose, almost tie the family together.
No, funny you mentioned that. I entertained the thought of having another child, and we did discuss it briefly.
It doesn't feel that long ago since Nat was on Jewish Tinder looking for her next partner, and now she's talking about having another kid. I mean, wow, time really does go by quick.
So is that a yes?
Yeah.
You're not sure?
No, Adrian booked in for a vasectomy the very next day.
Wait, what?
I kid you
No.
not.
The next day?
I brought up the subject of having a baby together, and he booked in for a vasectomy.
Well, honestly, every time you say that word, vasectomy,
Yeah.
I get a little,
You get shivers down there?
yeah, a bit more than shivers.
Not
I get,
tingles.
I get this little sharp pain.
Leonard, we've just been dispatched to an 11-year-old male child that says that he has fallen out of a tree with a head strike and he has an injured neck.
Oh.
Every time I get sent to a case involving children, I get a little bit of a sick feeling in my stomach because there's a lot at stake.
There's our waiver.
And at his age, having severe spinal injuries could be life-changing and catastrophic, not just to him, but for his whole family.
Hi, Natalie, Leonard. What's your name?
Debbie.
Hi, Debbie. Who's this?
Oscar.
Hey, Oscar.
Hi, Oscar.
Tell me what you've done today, buddy.
I was climbing the tree,
Of course you were.
and then I fell out,
Okay.
and I banged my head on it.
On the ground?
Yeah.
And so how did you get from over there to here, Oscar?
When I hit the ground, I got up and then walked and then fell over. He was quite disorientated.
Was he?
When I came over, he was dizzy.
Okay.
Yeah.
Alarm bells are definitely going off right now. Oscar's fallen over 2 metres, so I'm concerned about a number of things here. Does Oscar have a bleed, head injury? Has he fractured his skull? What other broken bones are we dealing with here?
Thank you.
In Melbourne's southeast, mobile intensive care paramedic Cam is racing to help a man in cardiac arrest.
The patient is critically unwell. His heart's stopped, so no blood's pumping, no air's going in and out.
Hello? G'day, I'm Cam.
He's extremely sweaty. You get rate to 22.
Yeah.
No blood pressure was ascertained.
Yeah.
The CPR performed by the paramedics at the house has worked. 78-year-old Ken has regained consciousness, but he's still in immense danger.
Add some IV on Danzatrine.
Yeah.
I've got adrenaline and some fentanyl drawn up.
Yeah. We'll try a little bit of atropine, see if we can speed up his heart rate. So that's 600 mics. I'm happy for that to go in. Sorry, what is your name? Julia. Jules. Hey, Jules. At the moment, he's really unwell, but we're going to look after him.
It's all right.
Ken's daughter Julia is in shock, watching her dad fight for his life.
It's all right, Dad.
I'm just going to listen to your breathing, mate. Just stay calm for me. Stay calm. Couple of big breaths for me. That's the way. So, very decreased air entry, no air entry to the lower right side. So that atropine didn't do anything, did it?
Not as yet, mate.
The medication hasn't worked. The team will now need to administer a second dose.
So for this one, I'm going to give him the 1200 mics, which is the full amount.
Oh, no. I know. So,
I can hear Julia talking to Ken. I can see he's terrified. I can't imagine how unwell he's feeling at the moment. He'd know something's really wrong.
I can't see anything rate-wise yet, but I'll just check the blood pressure.
Despite the treatment, Ken's vital signs are still dangerously low, and the second dose of atropine is having no effect. The crew are now preparing for the worst.
ready for an arrest.
All right. Ken, if you lose consciousness, we might just push on your chest to get your heart going, okay?
Right now, Ken's still extremely unwell. His heart rate's critically low. He's got no blood pressure. He's barely maintaining a conscious state. So at any time, he could go into cardiac arrest again.
Emergency services. Tell me exactly what's happened.
At the Emergency Telecommunications Centre, another urgent call for help is coming through.
I was walking along a trail when I stepped on a pig snake and it's eaten me. I've got 2 puncture marks.
Okay, and where have you been bitten?
On the ankle.
The woman was out exercising on a bush track in Hepburn Springs, 100 kilometres northwest of Melbourne.
Thames 5, cleared for takeoff. We are all set back. Doors at 4 o'clock.
Flight paramedic Matt is now on the way from the Essendon Air Base.
Ground snakes are one of the most venomous snakes in the world. Once the venom gets into your bloodstream and is transported throughout the rest of your body, it affects your breathing, it affects your muscles, but it also affects your blood's ability to clot, so people can start to bleed an awful lot. So we need to attend to snake bite patients very quickly.
Thames 5, we're airborne out of Essendon, on our way to Hepburn Springs.
How are you feeling? Does the limb feel like it's swelling at all?
I think it's starting to swell up. It feels like it's getting tight. I just feel a bit sick. Just panicking, that's all.
All right, just be still and wait for help. I'll stay on the phone with you all the way.
Yep.
I'll need to sort the backpack with a few drugs and then I'll just take some analgesia down, some adrenaline, some bandages.
It's steep country through there. Pretty thick bush, isn't it?
Yeah, mate.
A local paramedic team has now hiked through the difficult terrain and reached the snakebite victim.
Matt from Thames 5, are you with the patient there? Yes, we are. Blood pressure-wise and everything, heart rate and so forth, how's that going?
We're just doing that now. She's had 1 vomit.
Yep.
Blood pressure 136 on 8.2.
Yep.
The woman appears stable for now, but her body could start shutting down at any time.
If this patient doesn't get medical attention soon and the venom is transported throughout the rest of her body, she could die.
Back in Melbourne, 11-year-old Oscar is in shock after falling out of a tree. Nat and Leonard are worried the little adventurer may have serious injuries.
Oscar's actually fallen from a significant height, so has he got a head injury? Is there a bleed going on? Has he fractured his neck? Is it sore there?
No, it's on the very back of my head. I have a big bump out.
He's actually got quite a hematoma to the back of his head.
Yeah, wow.
There's a real possibility that after a fall from such a height, Oscar's brain has been shaken around inside his skull, leading to concussion. Can you move your leg? Okay, don't. Where's it sore? In there, okay. There may be a hip fracture there. You can wiggle those toes?
Yeah.
You can feel your foot?
Yeah.
Yes? Okay.
I want to be able to tell Oscar's mum and dad that their son is going to be okay, but the truth is, Nat and I are really worried about him. He could have a nasty head injury, he could have broken his hip, and he's still in a lot of pain.
So we're going to give him something called fentanyl.
Yep.
It's a really good pain relief for kids, and it really should help minimise that pain. Normally, a patient that has a potential spinal injury would be immobilised with a collar. However, Oscar's got a huge lump on the back of his head, causing him a lot of pain and distress. 3, 2, 1. Good, that's all. So in this case, we've decided to use head rolls to keep his head still rather than force a collar onto him. So let's pop that in your mouth.
To help Oscar cope with the ordeal of being moved to the ambulance, the fast-acting pain relief Penthrain is also being given.
We need to safely move Oscar onto a spine board, but there's no chance of moving him until we actually get that pain under control. Because at the moment, even the slightest touch causes him to scream out in pain. I'm really worried about Oscar.
He's so shut down, he's feeling really cold.
78-year-old Ken is fighting for his life after just surviving a cardiac arrest. Cam and a team of paramedics are urgently trying to raise his heart rate and blood pressure with the medication atropine.
Can you put another line in the other arm?
The worry is, if his vital signs can't be stabilised, the 78-year-old could go back into cardiac arrest.
He's still a very low blood pressure, even with his feet elevated.
So the second dose of atropines had no effect, but I've been preparing an adrenaline infusion. So it's time to hook that up. Hopefully that will pick up his heart rate and his blood pressure will come up with it.
So 5 mics a minute of adrenaline, just softly to see if we get an effect. I can't see anything, but I'll just check the blood pressure. Maybe pop it up to 10.
So the adrenaline infusion does nothing. So I'm going to give him a larger dose. But I'm thinking, what am I going to do if this doesn't work?
It's all right. It's all right, Dad.
Julia knows she could be losing her beloved dad.
My dad is amazing. He is a very generous person. He's a very kind person. My mum's got multiple sclerosis and he's been her carer for years.
Just look at me in the eye.
Yeah. He's always been in a caring role. Yeah. He's just been an amazing dad.
Oh, nice and warm.
I can see Julia getting really emotional. She's saying things like, you can go if you need, let go if you want, Dad.
Not yet, Jules. Not yet, mate.
But it's not time for goodbyes. We're going to do everything we can to save him.
I'll just see what that 15 mics a minute has done. Nice and still. Just checking your blood pressure, doing an ECG at the same time. I think it's time to move, mate.
The extra dose of adrenaline has had enough impact to allow Cam to transfer his critically ill patient to the ambulance.
Ready, set, go.
Now, I think Ken's heart rate and his blood pressure are stable enough. We can get to hospital.
You're doing okay. Doing a great job, buddy.
It's times like this that I am sitting on the edge of my seat. Am I going to get to hospital? Is his body going to keep responding to the adrenaline?
It's all right, it's all done, Dad. You can head us to the hospital. Yeah.
Even though things are looking good at the moment, things could go from bad to worse at any time.
We're good to go.
Foxy. Hey, mate, how are you?
Hi, big fella, how you going?
Yeah, give us one of those.
One of those?
It's the start of shift for regular partners, the odd couple, Mike and Eamon.
Do you notice anything a bit different about me?
And a little surprise has been organised.
What is that?
What do you think?
That is so lame.
What do you mean? But I got you one.
Oh, you didn't.
You got to wear that for me.
I can't. I'm not wearing that.
So during the COVID pandemic, we're obviously required to wear face masks. So someone in their infinite wisdom has decided to create a badge that has a picture of our face on it. But they look absolutely ridiculous. It's right up Foxy's alley, but it is not for me.
How about it can be a new badge for the car? We'll just leave it there. It's the Eamon ambulance. It's an ambulance.
Ambulance. I put a lot of hard work into this badge. I think it's a nice photo, but he doesn't appreciate it. If I had a face like that, I would be showing it off. He doesn't want to wear it, but yeah, he's gonna wear it.
Emergency services. Tell me exactly what happened.
I have a staff member who's bowled over, crippling in pain. She can barely...
Where's she feeling the pain?
Abdominal.
And she's having trouble breathing, is she?
Yeah.
Just try and reassure her that help is being arranged.
It's come through as a 34-year-old female, trouble breathing with some abdominal pain.
Okay.
She's pale, clammy, and that's all the information we have.
Could be a lot of things, eh?
This patient has a broad range of symptoms. So it could be something as simple as a stomach cramp, or something much more sinister like an ectopic pregnancy. We have to be prepared for the worst with this patient.
I'm really feeling a H. My chakras are aligning, my crystals are telling me, and it's saying H, Harry.
So Foxy and I have been attempting to guess patients' names for years now. Hundreds of times I've had this feeling, and not once have we got a patient's name right.
I'm actually getting a very different vibe. I'm getting a name with a double L in it. I'm thinking Chantel.
All right, Chantel.
It's now code 1.
Right. Well, hopefully her name's still Harriet.
So this job gets upgraded to a code 1, which means lights and sirens. So something has changed. Here we go, straight ahead. The patient's probably deteriorating and we need to get there quickly.
Hello. Hello, my name's Eamon. I've got Mike.
Hi there.
Oh. What's your name?
Bow, not today.
What's happening, Dale?
I've got endo.
You got endometriosis? Okay.
It just really hurt me out of nowhere. The intensity is pretty bad.
The intensity is much worse. Do you have any other sort of associated symptoms? Any sort of nausea?
It's really bad nausea.
All right. Any chance that you're pregnant?
No.
All right. Have you had any ectopic pregnancies in the past? No.
Carly Ann can hardly speak. She's in a huge amount of pain. She tells us that it's a flare-up of her endometriosis, which is an incredibly painful condition in which the lining of their uterus starts to grow outside of the uterus.
Temps 36.9, BP 114.83.
Okay. Do you think you'll be able to take a seat for me?
Endometriosis affects more than 800,000 Australian women, more than 11% of the female population.
There you go, that's what you look like.
Tragically, the chronic condition can also cause infertility.
I can't fix Carly Ann's endometriosis, but what I can fix is the pain that she's in.
So this is ketamine. It's a spray in the nostril.
Eamon's now giving Carly Ann highly effective intranasal ketamine as well as fentanyl.
Little scratch, okay? Do you have a pain management plan for your endometriosis?
No. They want to give me a hysterectomy, but I'm just not ready yet.
Okay.
Carly Ann's been through all this terrible pain and now she's being told the only way to really get it fixed is have major surgery, like life-changing surgery in her early 30s. That's massive.
All right, let's head out to the truck.
I feel for her. My heart really goes out to her.
Doing really well.
Okay, they should be in this area here at 3 o'clock now. Can you see the
Ambo's on the ground there.
I see that, yep, I see the scene, mate.
100 kilometres away, northwest of Melbourne, flight paramedic Matt and the air ambulance team are under pressure to rescue a 31-year-old woman who's been bitten by a lethal brown snake. A local ambulance crew is now with the patient, but it took them over an hour to hike in on the rugged bush track.
M5, we're overhead at scene at the moment. What's the likelihood of getting them out?
It's very unsafe for us to walk around. You're bouncing around a lot.
How long would it take to walk around?
45 minutes to an hour, probably.
So the crew on the ground are informing us that it's going to take them a long time to get the patient out over unsteady ground. And the concern with that is after you've been bitten by a snake, you want to try and stop the venom moving around the body. So you want to keep the patient nice and still as much as you can.
Ideally, you would winch her out.
If there's no other option, then we can do it, but it is a last resort, mate.
Right door is coming back.
How you going, Ken? Do you feel sick, like you could vomit or anything?
No.
I'll just check that BP again.
Intensive care paramedic Cam is on his way to hospital with 78-year-old Ken. After his heart rate and blood pressure dropped dangerously low, Ken went into cardiac arrest.
132 on 62, heart rate 66.
Cam and Micah paramedic Brad are running an adrenaline infusion to try to keep Ken's blood pressure and heart rate stable.
You still got those shakes, Ken? Yeah. Still, I'd say it's a byproduct of that medicine to keep your heart beating the way that it should.
These drives into hospital are tricky. You never want to let your guard down, just in case things change.
I'm sure Julia will be close behind us.
She shouldn't be too far.
Ken's distressed daughter Julia is following the ambulance to hospital.
My dad just means so much to me. So knowing that this could be the end, it's the hardest thing ever. I just can't imagine life without Dad. I love him to pieces.
Hey, Ken, I'm just going to pop another tiny needle in the back of your hand here.
It just goes to show how fragile life can be. As a paramedic, you see life, you see death, and you see people die before their time. Makes you really realise how important sharing experiences with family and friends is. Never take it for granted.
So we're here, Ken. Okay, nice and easy.
So now we're at hospital, I'm able to breathe a little bit easier, but I don't know what's going to happen from here. He could stop responding to the adrenaline. We're still not out of the woods.
Resus 1.
You're being super, super brave. You're in safe hands, okay? You've got Mum here.
It's okay.
11-year-old Oscar is traumatised after falling 2 metres out of a tree. Nat and Leonard are worried about head and spinal cord injuries, as well as a potential hip fracture.
Okay, I want some really nice deep breaths.
Yeah. Bit more, there we go. Well done.
When we move Oscar, we need to make sure that we keep him as still as possible.
So ready, set, go. Keep breathing on it, mate.
Because if Oscar has a spinal cord injury, which we can't completely rule out, then any little movement could be the difference between walking and not.
Ready, set, go.
Okay.
Doing a good job, buddy.
Okay. Okay, we're done. We're not going to move you anymore. You did so well, Oscar.
Seeing their little boy so distressed is heartbreaking for Oscar's mum and dad.
The idea of using that much pain, it's awful. It's my best mate. Yeah, absolutely helpless you feel because you just want to do something. It's like, I mean, if I could just pick him up and run to the hospital with a kid, I would, but you just got to wait and just hope for the best.
Now, mate, I'm just going to put a little bit of tape just across your forehead. Is that all right?
Due to the large bump on the back of Oscar's head, Nat and Leonard have been forced to use head rolls, not a collar, to keep the little boy immobilised.
We're gonna never come to this tree again, dude.
So he's had 50 mics of fentanyl.
Yes.
He's had 3 mils of methoxy, and now we're going to go 4 milligrams of Ondans. And you've checked contras, haven't you?
I checked all contras.
Yeah.
Yeah, all good.
So contra would be a reason why we wouldn't give you a medication. It's called a contraindication. That's a really good question, actually. OK.
That is a very good question.
I don't think I've ever had anyone ask me, what is a contra? And that goes for all my adult patients, so we might have a future paramedic on our hands. It's pretty cute.
How are you going there, Oscar? You OK? As good as can be, yeah? You're actually doing really well. You're hungry, are you? Should we do drive-through on the way?
Drive-through Macca's?
Drive-through Macca's? Should we pick up some Macca's on the way?
Yeah.
Yeah? OK.
Are you joking?
I am joking. What is it with sick kids and food? You know, they start to think about what they're going to get for dinner when they're sick, and I'm just thinking about, let's get you to hospital, buddy.
Nat and Leonard have done their job, helping Oscar forget about his pain.
Just keep that neck and head nice and still. You're doing a fantastic job.
But Mum Debbie won't relax until she knows her son will be able to make a full recovery from his thrill-seeker fall.
Mum's coming in with us, OK, Oscar? Good boy. I'm really hopeful that Oscar hasn't suffered any major damage, but until those scans and x-rays are completed, we just don't know how serious his injuries are.
Mum will be here every step of the way.
Just stay on the track, Trip.
In country Victoria, flight paramedic Matt and crewman Trevor are on an urgent mission to rescue a snakebite victim stranded hundreds of metres away on a bush track. The 31-year-old woman was out jogging by herself when she was bitten by a deadly brown snake. For now, her condition is stable, but she could quickly crash if the poison starts spreading through her system.
Step down through here.
G'day, how you going on, Matt?
G'day, Matt, I'm Reed.
Reed, what do you do for a job?
I'm an ambo.
I thought I recognised you. So you know exactly what's going on?
She's taken a couple of extra steps to get away from the snake and then she set herself down. She's taken her shoes off and wrapped her leg. We've just added a dressing over the top.
Sure.
Ree's extensive paramedic training and quick thinking may well have saved her life, but she's still in danger.
How do you feel right now?
Real fuzzy and lightheaded.
Fuzzy and lightheaded. Vomited just once so far?
Twice.
Twice.
Yeah.
Rhea has done an amazing job. She's had the presence of mind to stop, calm herself down, take control of the bite mark and provide first aid to it, but she's clearly feeling unwell right now.
Do you have a sheet or anything that we can do as a bit more shading for Rhea?
It's been 2 hours since the paramedic was bitten. Matt has to make the call about how they're getting Rhea out of the steep gully.
I look at the terrain that's around me and I look at where I am and I think to myself, how are we going to get out of here? And the best option that I can see at this stage is that we are going to need to winch the patient out.
Rhea, if we can get you out of here, give us your hand. Righto. Lie back. Now that arm through there. Righto. The helicopter will be overhead in a couple of minutes.
Okay, 1, 2, 3. The hoist is now on, mate.
Roger that. Set in the back, set for lift.
Copy, and coming up.
Roger. And mates are just coming through now. Tail is clear.
Over, mate.
Sounds like they're up. Righto, so that is fully secure around you. You're not going to go anywhere now. The only thing is you'll get a bit of noise. Obviously, you'll get shit blown down on your face. Yeah. I'll be right next to you the whole time.
I do my final checks. I've ensured that Rhea is okay and I've given the thumbs up for their helicopter to come. At that point, the crewmen start to make the approach and they can guide the helicopter into where we are.
And target is 3 o'clock, 800.
And visual, mate.
Roger.
So that's secure, that's secure. Go up chest strap. You're okay. Goggles over your face. You're good to go.
Okay.
And we are committed, mate.
Roger, committed. Line is good, speed is good.
Perfect, mate. I'm not sure we're going to get much lower than this.
That's a bit bumpy, isn't it?
Yep.
When you are standing and waiting for the helicopter to come to you, it is an amazing view. You have this big machine that's hovering overhead. There's dust, there's wind, there's debris that comes towards you. There's a lot of emotion that comes in with that helicopter arriving.
Move right on line.
We've got 20 to run.
The patient is unsure of what it's going to feel like. What happens if something happens? There'd be 1,000 things going through their head, and I can't comprehend how anxious and nervous Ree must be feeling.
5 to run. 4, 3, 2, 1.
Little bump here.
34-year-old Carly Ann is on the way to hospital after being struck down by an excruciating case of endometriosis.
All right.
The chronic condition can cause infertility, and some women take the extreme measure of having a hysterectomy to stop the pain.
Honestly, I wish I was born with a penis so much.
Look, there's some perks, I'm not going to lie.
There's a lot of perks.
Let's be honest, I can't imagine the sort of stuff that she and other women go through. They deserve some serious kudos.
Fentanyl and the highly effective ketamine are starting to help Carly Ann cope with her agonising stomach cramps. She's even started noticing Eamon's new badge.
So what's up with the badges of yourself? Is it because you've got masks on, right? Okay, so...
I was so confident that no one was going to see these badges. And lo and behold, the first patient that we go to notices it. I'm floored.
Well, what do you think of the badges? Do you think they're a bit lame?
I understand the theory behind it, but it's covered up by the thing, and they wouldn't be able to see that tiny little picture anyway.
Exactly. I knew I liked you, Carly.
But the initial statement was that they're good, aren't they, Carly? They're a good idea, maybe just need to be a bit bigger.
Yeah.
Bigger? She's got to be kidding me. They need to be smaller, non-existent, not on me.
How's your pain? Better?
Just missing a margarita and a cheese platter.
Just pulling up now.
We've had a good chat and had a bit of a laugh, and we're at a hospital safely. I'd say that's a job well done.
Sounds like you're having an all-round good time back here now.
Carly Ann now faces a battery of tests at hospital.
So we'll be a couple of bumps and noises as we come out. Here we go.
But that's nothing compared to the huge life decision facing the brave 34-year-old.
I hope they find a solution for Carly Ann that doesn't involve a hysterectomy, because that's got to be devastating for someone her age.
Line and speed is good. Okay.
100 kilometres from Melbourne, flight paramedic Matt is about to winch Ree out of a steep gully to the air ambulance.
Position is really good. Now it's good, mate. Roger that.
The off-duty paramedic has been bitten by a deadly brown snake, and she urgently needs to get to hospital for life-saving anti-venom.
Just winching the hook out. Kevin has the hook and he's just securing the patient. Try not risk maintain. Your tail is well clear. Clear around. And still hooking up the spider. And I have a single pump. Winching in the slag. Winching in the slag. And taking the load. Okay. Clear the winch. Roger that. Load is coming clear of the ground. And winching.
Ree shuts her eyes, and I guess for her, that's like when you're going on a roller coaster and you're about to go over the edge, you realise this is happening, I've got no control of it now, I've got to close my eyes and just put my trust in the person looking after me.
Just near the aircraft now, just stabilising alongside. You are clear to climb. Slowly. Equipment and survivor at the door. Bring from the survivor input.
This is not a graceful procedure at all. There's a lot of shoving, there's a lot of pushing, and the crewman pushes me and I'm pushing Ree.
Just got her on the stretcher.
But the last thing we want is for the patient to start to panic and move towards the door of the helicopter. We need to make sure everybody is safe.
We are secure in the back, mate. Good to go. Copy, mate. Do you feel sick? A little bit? And pain-wise now?
It's like a burning.
In your leg?
Yep.
Okay.
A bit of a headache.
A bit of a headache. And nausea?
Yeah.
Might just draw up some more fentanyl for you.
Ree has pain in her leg where she has been bitten. My concerns at this stage are, how is she going to go from here? Is she going to get worse? Is there going to be more venom that is released throughout her body and she will develop further symptoms? I don't know at this stage.
For Ree, the significance of what's happened today is starting to sink in.
Bloody hell. This is not how the day was supposed to go.
No. You see the snake, obviously?
A big, dirty...
House dead. Was it a big one, was it?
Yeah. See how I missed him?
Yeah.
Most paramedics are very resilient and very strong. And Ree is clearly displaying that. She's tolerating this like a real trooper, so she's done extremely well.
That plane's starting to creep up again.
Is it?
Yeah.
With the Royal Melbourne Hospital now in sight, emergency doctors are on standby to administer the snake anti-venom.
And committed, mate. Present. And coming down, mate. Present.
So although Ree is clinically stable, the next 12 to 24 hours are the critical time for her.
Yeah, happy to come out, mate.
She can still deteriorate to becoming very unwell. All right, let's get you in there.
Six weeks ago, Oscar fell 2 metres out of a tree, landing on his head.
He's actually got quite a hematoma to the back of his head.
Yeah, wow.
But after giving his parents the fright of their lives, the 11-year-old is now back at home. He may not be climbing trees, but he's definitely enjoying life. Oscar spent 3 days in hospital. He was cleared of any broken bones or spinal damage, but doctors confirmed he did suffer a serious head injury.
He had a concussion. It was quite severe, so we had to keep him resting for a couple of weeks. He wasn't allowed to ride a bike and he wasn't allowed to do anything that he might hurt his head. It was pretty difficult. But now he's back to being normal and able to run around, and I was terrified that wasn't going to happen.
As for endometriosis patient Carly Ann, she spent 2 days in hospital. The 34-year-old is booked in for surgery and is hoping it'll help keep the debilitating condition under control for the next few years.
How's your pain? Better?
Carly Ann is still deciding about a hysterectomy.
Just want you to hook out.
31-year-old Ree was winched out of a treacherous gully after being bitten on the leg by a deadly brown snake.
Bring from his library book.
The paramedics spent 2 nights in hospital. To be certain, doctors gave her both brown and tiger snake anti-venom.
So that should neutralise any of the toxin that's been absorbed into the bloodstream.
The serum worked, and Ree is back on the job. While she's still suffering from nausea and headaches, the paramedic is grateful for the lifesavers who came to her rescue.
I've got the most amazing colleagues in the world. I've got so much respect, and I'm so thankful for everything they did that day. My message for anyone that is like me and can't sit still and wants to go out adventuring, do it, but make sure you're prepared. Have a fully charged phone. Learn how to use your GPS coordinates and do your basic first aid, because it will save your life one day.
Ken, we might just push on your chest to get your heart going, okay?
Ken collapsed and went into cardiac arrest on his lounge room floor.
Just stay calm for me, stay calm.
Cam and a team of paramedics stabilised the 78-year-old and managed to get him to hospital.
It's all right. It's all right, Dad. I didn't want to leave Dad at all. He was so vulnerable. All that I wanted to do was tell him that I loved him.
Daughter Julia was terrified her father wouldn't make it.
Dad, do you want a cup of tea?
Thanks, lady. Is there one going?
Yep.
Good. But the 78-year-old did survive and had a pacemaker inserted. After weeks of rehabilitation, Ken's now on the road to a full recovery.
I love jobs like this. I've walked into somebody who was critically unwell, and together with a team of other paramedics, we've taken him from really the brink of death and given him a second chance at life. I told Julia we'd do everything we could to save her dad, and I'm glad I was able to keep my promise.
See that? That's what I want to see.
I know.
Not the tears anymore. Paramedics are absolutely brilliant, and I cannot talk highly enough of them. I mean, let's face it, they saved my life.
Emergency services. Tell me exactly what's happened.
We were just at the playground and a dog just started attacking my friend's son.
At the Victorian Emergency Communications Centre, a frightened caller is on the line.
Is there any serious bleeding?
There is some bleeding.
And what part of the body was bitten?
On the side of the hip. Mum's saying that there's some flesh showing, so she's a bit scared to look.
All right, I'm just organising some help for you now.
Right at the logs. He's coming in hot. Roger. You're good.
Mike and Eamon are being sent Code 1 lights and sirens to the 5-year-old boy.
Right, Focky. He's been attacked by a German Shepherd. The mum is stressed, plus. How terrible.
Dogs' jaws are incredibly strong. Like, we could be talking lacerations, bleeding, broken bones, because kids' bones, they're pretty soft. They will bend and break really easily under the force of a dog's jaw.
Bloody hell, a German Shepherd, that's a big dog. Yeah. He's going deaf, this bloke. Yeah, he is now.
Depending on the force of the bite from this dog, it could be life-ending, life-altering. It's going to be potential for huge injuries with this child.
I am really super excited for you because I think you will make an excellent paramedic.
Across town, Nat is congratulating Leonard on his new promotion.
So good news, I passed my Micah course, finished, done forever, and now I get to start on road.
Micahs are the elite paramedics of Ambulance Victoria, dealing with only the most serious cases.
I can't wait to one day be at a job with you as Mike and me as ALS. I'm super proud of him to be fulfilling his dream. It's just amazing. I'm just thrilled for him.
It's a commitment, but it's a commitment I want to take. And you know me, when I do something, I'm going to do it well.
I do.
And I'm going to commit fully.
Sadly, today is one of the last shifts these paramedic buddies will spend together.
Nat might not want to admit it, but she's going to miss me when I'm gone. She just won't tell me to my face.
You will remember, though, that you started on an ALS truck, won't you? I keep telling Leonard that he will definitely miss me. We have so much fun together. We laugh, we talk about everything. You just remember where you started, OK? And he needs to enjoy working with me while it lasts, because soon he'll be on a micro ambulance and there's just no one out there like me.
Oh, no. We just got sent to a female. She slipped over and it's query fractured leg.
So she slipped?
Yeah. Leg is twisted. Patient sitting at step of a shallow pool.
Anytime something comes through saying that the leg is twisted in the wrong direction, I think this is not going to be good.
She's actually on the 19th floor of a hotel.
Wow.
You can hear it.
Difficult extrication already.
Very difficult.
We're going to need stair chair for sure.
G'day. Obviously, you guys aren't doing too well.
As soon as we arrive on scene and I see the patient is still in the swimming pool, I just think this is going to be tough to get her out.
What's your name?
Michelle.
Michelle? Yes. Hi, my name's Leonard. What's your name, mate?
Nate.
Nate, are you Michelle's partner? I'm probably going to need your help at some point in time. Michelle, how have you done what you've done? So have you walked up?
I was just walking from the second step and hit the side.
I can't move it.
Yeah.
OK. This poor lady, beautiful rooftop pool. She's got her bathers on, she's looking good, steps into the pool, bang, falls, breaks her leg. I mean, it's a nightmare scenario for her.
It might seem like a really silly question, but how bad's the pain?
Oh my God. 10?
10?
10 out of 10.
Yeah, all right.
So the first thing we need to do is to get on top of Michelle's pain. She's in absolute agony.
I'm going to give you the green whistle. I don't know if you've used it or seen it before.
We can't splint the leg until she's comfortable, so we really need to give her as many analgesic medications as we can.
Breathe in through the mouth and out through the nose.
I can see the bone almost poking through the skin, and the leg just looks like it's on a completely wrong angle. It is a terrible fracture.
Now you can do it, you can do it. Keep it in your mouth.
300 metres.
Mike and Eamon are about to arrive at a kid's playground where a 5-year-old has been attacked by a German Shepherd.
There's a waiver or two over there. Yeah. Through this car park? Yeah.
Hello.
The team is met by the little boy's distressed family and friends.
Do you know the young fella?
Yes, it's my friend's son.
He's your friend's son.
He's my brother.
He's your brother. What's your brother's name? Leo. Okay. Hello. My name's Eamon. I've got Mike. What's happened with Leo? Let's have a look, okay? Leo, you're okay, mate. Oh, he's got a good... Leo is hysterical, and at this point, I don't know if he's hysterical from the pain or it's just the trauma of being ragdolled by this German Shepherd.
Yeah, right, mate. We're just going to look at him. There's Mum. Hey, buddy. Great job, Leo. Got abrasion here, puncture wound there. Yeah.
There's a fair bit of bite force in a German Shepherd, isn't there? Okay? I know.
God.
It's okay, mate.
You're so brave.
All right. So what happened, Mum?
He's standing on the playground and I saw this kid screaming. I come in and then I saw the owner took the dog, but he's already by Leo.
Okay. Mum tells us that she's heard Leo screaming and she's grabbed her child out of the mouth of this dog and then thought this dog away to protect her kid. Was he crying straight away?
Yeah.
Has he been able to walk around at all? Did he run over to you at all? Straight after?
I picked him from the ground.
You picked him up from the ground. Look, let's get him up and out of the public view. We'll get him over into the ambulance. You carry him, all right?
Without a full assessment, there's no way to know what's going on internally.
We don't know yet what that fang has potentially punctured inside his abdomen. A dog's mouth is a dirty place and we're penetrating the skin, so there's a huge risk of infection. So the dog's lifted him up in the air?
The owner tried to keep him, but the dog's too big to control.
Yeah. It's a harrowing story. It's a frightening story. It's one that I think any parent would shudder at the thought of. Very scary, isn't it?
It was scary first time.
I am so excited to go home to Perth.
I wish I was coming.
Oh, you'd love it.
It's the start of shift for besties Emily and Steve. With all of Emily's family in Perth, Steve's become her surrogate brother.
Emily is the most sweet, bubbly girl you will ever meet. We joke and say that we're soulmates.
How do you like your steak?
Medium rare, babe.
No, it must be well done.
I want to know that I'm eating actual steak. They're burning.
Oh my goodness. As soon as Steve and I met, it was just like, you are my person. We just connected on such a deep level really quickly. He just makes everybody around him feel so loved. He's just a really beautiful character.
I love Emily. She's always there for me. If I was straight, I would marry Emily.
Emergency services. Tell me exactly what happened.
My sister, she seems very confused. I wouldn't be surprised if she's had another stroke.
All right, I'm organising help for you now.
Okay, so we're going to a 83-year-old female querying stroke, and she had a stroke before 6 months ago, Em.
She's 83, she's got all the risk factors. Let's hope for her sake it's not.
Almost 15,000 Victorians a year suffer a stroke. Brain cells die from the decreased blood flow and lack of oxygen.
This way, love. No.
All stroke patients are time critical, and today's city peak hour traffic is testing Emily and Steve's patience.
Move, my love.
Oh, I'm mounting curbs. It's extremely frustrating when you're on the way to a potentially life-threatening job and people won't move out of your way. Move.
Yes. I love that horn so much. Okay, so it's all the way at the end. I think the nuns live here.
Oh, it's a nunnery.
Yeah.
I love the nuns. They dedicate their life to their work, which I find very admirable, and I have a soft spot for the elderly. It's like the doctor saying you need 1 apple a day. For me, it's 1 nonna a day, or 1 grandma a day, or 1 yaya, and I am happy.
Hello, how you going? I'm Stephen, this is Emily.
Mary is
Mary's the patient.
Hello.
Hello, Mary.
Already on the scene is a member of Ambulance Victoria's specialised stroke unit, Richard.
Mary was seen well last night.
Yep.
Today, her brother has had a chat to her. He noticed that she was confused more than normal.
Yep. Do you feel vague? Like you can't get out what you want to say properly?
I'm not able to.
Alarm bells are going off. Confusion is one of the main signs for a stroke, and if that is happening to Mary, it would honestly be absolutely devastating.
And
Mummy right here. Mummy right here.
It's okay. Mummy's going to be just behind you.
At a playground in Melbourne's southeast, 5-year-old Leo has been attacked by a German Shepherd.
All right. Hi, Leo.
Eamon and Mike need to calm down the traumatised little boy so they can investigate the extent of his injuries.
It's okay, Leo. It's okay. Let's take your top off. Show me how big your muscles are.
We know the bite force in a German Shepherd is huge. There's a reason that they're used in militaries and police forces around the world.
You are so good.
Once those dogs latch on, they are going to clamp down and not let go until someone forces that dog off the child.
What were you doing at the park? Were you playing on the swings? No. No? It's okay, Leo. Mummy's just behind you. Yeah.
It looks like just the one significant bite to the jacket, mate.
Yeah, I can see the puncture marks. Okay, we won't touch it. We won't touch it. We won't touch it, okay? That's all right.
Having a look at Leo's jacket, I can see that the stuffing is pulled out. There's a big puncture wound from where this dog has got him. I hate to think the amount of damage that would have been done if he was just in a T-shirt or something. It'd probably be a very different story.
Look at you go. How brave are you?
Eamon is now checking Leo's oxygen levels, blood pressure and heart rate to look for any signs of internal bleeding.
Can you see all the flashing dots there? That's all about you. Sats are good. Let's let him settle with a bit of fentanyl. All right. I'm going to give you some special medicine, okay? See, look at this one. It's magic. Ready? No, you watch. Ready? Here we go. Ready?
Oh, look at that.
Look at that. Can you feel it? Feels like rain.
What does it do?
It makes you feel better. All right, ready? It's okay. It's okay.
Leo's hysterical at the moment. He's so difficult to assess. I don't know how deep this bite has gone into Leo. I don't know if he has any fractures. He's got huge potential to get an infection from this bite. And then he's got the emotional trauma, the mental trauma from this. He may never be able to approach a dog ever again in his life.
Leo, it's okay.
So painful.
I know. So the more painful it is, the more I want you to focus on taking deep breaths in through the mouth.
Michelle and her partner Nate were trying to have a romantic night in a hotel, but it's ended in disaster.
Trying to get her at least to just out of the water, yeah.
Michelle has fallen over in the pool and has an horrendous fracture of her right leg.
I am getting another crew for help, okay?
Yes, lovely, thank you.
Because I really think this is going to be a long extrication.
Penthrain, also known as the green whistle, and intranasal ketamine are being given, but there are complications.
So it's really important for me to treat Michelle's pain, but at the same time, it's a really delicate balance because I don't want to give her so much pain relief that she goes unconscious. At the end of the day, I need her help to get out of the swimming pool as well.
We're not going to rush this, okay? We're going to do it slowly. We're going to get you comfortable. The last thing we want to do is cause more pain.
Michelle's leg needs to be splintered as soon as possible, but working in this confined space is a massive challenge.
You're doing good now. You're breathing on it well.
As soon as the pain relief takes effect, Leonard gets everyone ready for the difficult transfer.
Breathe, breathe, breathe. Breathe, breathe,
Well
breathe.
done.
Hold her foot.
Keep breathing.
Hold her foot. Hold her foot.
Keep breathing, keep breathing,
Hold her
keep
foot.
breathing.
Well done.
Well done,
Deep breath.
well done, well done. Gonna lie down, well done. With that type of pain, I reckon ketamine, straight up.
It's an obvious deformity. Yes, we're going to.
Significant fractures of the lower leg can lead to a lot of complications. It can lead to permanent nerve damage, a lack of blood supply. People can be left with permanent disability from even a fracture.
Take a deep breath.
We will attempt to irrigate, and then we will transport.
No dramas, mate.
5-year-old Leo has been attacked by a dog.
All right, we've got to fix it.
Despite pain relief already being given, Leo is still distressed. But his bite wounds have to be cleaned to prevent serious infection.
Securing a dressing is going to be troublesome.
Yeah, I reckon just irrigate, mate.
Yeah, I think we've irrigated as best we
Yeah, because it's not hemorrhaging.
Yeah. Leo, it's okay.
I'm looking at Leo's face and his lips are starting to tremble. He's starting to shake. He's really scared. He's absolutely traumatised.
Your mummy's sitting just behind you. We're good to go, mate.
Roger, moving off.
And we're going to go see the doctors and the nurses. Good job. You're so brave. Do you want to see a magic trick, Leo? This is probably my best ever magic trick, okay?
The trick to any great magic trick is you've got to have some theatre about it. You've got to build it up. So I'm setting Leo up.
I haven't even shown Mike this one yet.
I can see, he's ready to have his mind blown.
Ready? We have to sprinkle some magic dust on the bit of paper. So we sprinkle, sprinkle, sprinkle. You got to put some on. You got to sprinkle it on, otherwise it won't disappear. Ooh, too much. We've got just a bit much.
And finally, I hit the penultimate moment of this magic trick.
1, 2, 3. Where'd it go? Oh. Wow. Was that good? Tough crowd.
Tough crowd. How'd he do it?
And nothing. Leo just looks at me like I am the village idiot. He's thinking, don't quit your day job, just get me to a hospital and be quiet.
What's your favourite animal? You like a cat? I like cats too, you know. I don't have a cat. I have a dog. My dog's name's Walter. He's a very nice dog. Do you want to see a picture of him? No, that's okay. That's fair enough. Dogs are a bit on the nose at the moment. Hey, Leo, we're at the hospital, and you get to come in on our special bed because you're our special patient today. Hi, Mum. Good job.
Here we go. Mum's right here. You've been such a big, brave boy. Woohoo! And you watched Eamon's magic trick, which he loves.
That was my best magic trick yet.
I know that there's a potential Leo might need surgery and he might even need plastic surgery. So an innocent trip to the playground for Leo has potentially huge consequences for the rest of his life.
Mum is right here. There she is.
How are you feeling, Mary? Do you feel more confused than normal?
Steve and Emily are becoming increasingly worried about the confused state of 83-year-old Mary. The elderly nun has already suffered one stroke a few months ago and could now be having another.
This is not normal for her at all, is it, to be speaking like this?
No.
Because she's answering questions appropriately, but it's like she can't express herself.
That's right,
at some
yes.
points.
Sister Joan is fearing the worst for her best friend.
So, Mary, Richard's just going to do a little assessment on you.
If you just look at me, that's all right. Give me a big smile. Show me your teeth.
So what we're looking for is, does she have any facial droop? Is her speech slurred?
Now with your hands reach up and grab hold of my fingers.
And are her grips strong bilaterally?
That's it. Give them a nice tight squeeze for me. And your sensations here, does it feel the same on both sides?
Yes.
Yeah. Okay, good. That all looks good.
Good news is that we don't think Sister Mary is having a stroke today, but we still have to get to the bottom of this problem.
We're just going to pop these dots on, have a look at what your heart's doing.
You have a temperature of 37.8.
So Mary's heart rate's good, her blood pressure's good, her sugars are good, but Mary's got a temperature. So what I'm thinking is that Mary has an infection somewhere.
Have you got any wounds or anything that could be infected?
No.
Okay. Do you have any pain while going to the toilet or anything? Have you had a UTI before?
Have I had?
Urinary tract infection before?
Yes. Haven't you, Mary?
She has? Yeah.
Yes.
We'll have to take you up to hospital for investigation. How does that sound?
Okay, that's fine. I'll come with you.
So worst case scenario here is if left untreated, Mary gets this UTI that then goes into her bloodstream and she becomes septic from this.
Alrighty, Mary, let's go.
Sepsis is an infection that can kill you.
Are you right, darling? Slow and steady wins the race.
Take a deep breath.
On a romantic night away, 38-year-old Michelle has fallen in the hotel pool, fracturing her leg in several places.
Yep, keep going, love. Okay, heart rate's 84.
Yeah.
So that's a 99%.
Nat and Leonard are giving Michelle strong pain relief before the ordeal of moving her to the ambulance 19 floors below.
3, 2, 1.
Oh. Yeah.
There we go.
Good stuff. You guys here on holiday or?
Yeah, we were.
For the night.
For the night, one night.
Just
This happened.
arrived, did you?
Goodness me.
My heart absolutely goes out to Michelle and Nathan. They're just trying to enjoy one romantic evening away, and then this happens. I really feel for them.
What are you worried about, Michelle?
I'm a mother of 2 special needs children.
Oh.
And I just wish it didn't happen to me.
Oh. Look, it's an accident and it's a bit unlucky, isn't it? But this won't define your life. And
I want a weekend away.
oh.
Sorry, babe.
Poor Michelle, she's a working mother with 2 special needs kids. I can understand that she's genuinely concerned. Who's going to look after the kids? Who's going to help her? We as mums just don't have time to get injured.
I'm going to have a bit of a feel of your leg.
Michelle's fracture is now being assessed before splinting can begin.
Can you feel if I'm touching your toes?
Yeah.
You can feel that, okay. Can you wiggle your toes? Beautiful. She's got good sensation and we've got good movement of the toes. So in terms of neurovascular status, it's good.
Okay. Sharp sting coming up.
A splint is needed to realign Michelle's bones before getting her on the stretcher.
Okay, deep breaths for me,
Really
Michelle.
deep breaths.
Okay. Okay.
Keep breathing on that, Michelle.
I reckon down.
Go down, down.
Down. I think just for a minute.
We're going to give you a bit more pain relief, Michelle.
Yep.
You're doing really well.
It's really important to get Michelle to hospital quickly. At the end of the day, she needs to get those bones surgically repaired so that she can have a short recovery time and get back to her kids.
Deep breaths.
At the Essendon Air Base, intensive care flight paramedic Matt is on his way to a frightening road accident 180 kilometres from Melbourne in the Victorian High Country.
Hems 5 to Westeros. Any AV crews arrived at scene yet?
Negative, not as yet. However, Bridge Creek don't look too far off now.
Are there any reports on the second patient?
Negative, no reports on the second person involved at all.
2 motorbikes have collided and one of the riders is seriously injured.
I don't know why people ride motorbikes. I understand it can be exhilarating, but at the end of the day, you are very vulnerable. You come off a motorbike and there's not an awful lot to protect you.
There's a big sport table right near it, man. Is that? It's good. The Hems crew's been in there before.
He has the potential to have a head injury, he has the potential for a neck injury, plus other injuries going on throughout the rest of the body.
Clear the pencil line, mate. Yeah, clear this. To ground left.
As the air ambulance team prepares for landing, local paramedics have now arrived at the accident site. One rider has been cleared of injury, but there are serious concerns for off-duty firefighter Bruce, who is still lying on the road.
Hey, mate. How you going?
As we arrive, my concerns increase dramatically. The immediate thing that goes through my head is, why hasn't he got up? Why hasn't he moved?
Got a 59-year-old fella here.
Yep.
He was travelling 60 kilometres an hour.
Yep.
He's been head-on into another bike.
I start thinking, has he got a spinal problem? Has he got severe fractures? Maybe he's got internal bleeding. So my apprehension and concerns for him at this point are heightened.
You can sit down, just pop your bottom down. Perfect.
83-year-old nun Mary has a fever and is very confused. Steve and Emily are worried she may be suffering a urinary tract infection.
I am ready to go.
While UTIs are common, in the elderly, they can be very dangerous.
In the worst case scenario, UTIs can lead to a blood infection, and then the blood infection can lead to death. It's actually quite shocking what a UTI can do to you.
So you're both nuns?
At the convent?
Yeah.
Yes, I entered there before you were born in 1952.
Mary's longtime friend, Sister Joan, is on board for support.
Are you allowed to get married?
No.
No.
We take a vow to remain single.
Okay.
So that we can look after anyone and everyone.
Okay. Are you in celibacy as well?
Yes.
Okay. What a huge commitment to make.
Maybe I can be 6 months celibate, and that's about it. That's where I draw the line in the sand.
I worked in a men's prison in Queensland.
Ah, okay.
And then I did 2 years missionary work in Thailand, working with women caught up in prostitution.
Okay.
And Mary worked for nearly 40 years with women prisoners.
Oh, wow. That's fantastic.
Yeah.
But I loved it.
Definitely rewarding work.
Yes.
Been a great life, hasn't it, Mary?
Yes.
Yeah.
These women are incredible. Listening to Mary and Joan's story about how much they've conquered and done together is amazing. I just sit there in awe and go, tell me more.
You're so good, all of you. I don't know what we'd do without you.
Oh, thanks, Joan.
Yeah, no, you're marvellous.
No, Emily's the good one.
She's good.
Yeah.
So are you.
I'm the wicked one.
I don't think so.
How are you feeling, darling? Now, normally when you have a conversation with Mary, Joan, it's like back and forth like we're having.
Yes.
Yeah, so she seems a lot more slower than usual, would you say?
Yes.
Yeah.
Fortunately, the team are now arriving at hospital where doctors are waiting to assess Mary.
We'll get you on out, we'll get you to see a doctor and hopefully sort out today's problem.
My hope for Mary is that she doesn't have a sepsis. She's such a beautiful woman. I would hate for anything to happen to her.
Joan, just follow us.
Thanks, Steve, for your treasure.
Hopefully, she's going to be okay.
Mary was just so beautiful.
Yeah, they were both lovely.
I know. What about the bombshell of celibacy? I just can't believe that's how it works.
There's absolutely no way that Steve would ever make it as a nun. He'd look really good in a habit, though.
That is too funny.
How's that pain going?
I actually don't want to move my leg.
Righto.
In Victoria's high country, 59-year-old Bruce has been on a week-long motorbike holiday with his mates.
Where are you sore at the moment, Bruce?
It's like I've just had a massive football corky right down the side.
So when you bend the knee up, is it causing any pain anywhere at all or not? Just in the hip? No worries.
But the good times for the man, nicknamed Simo, have ended in a terrifying collision with another motorcycle crashing into his right side at 60 kilometres per hour.
We'll get you off all this stuff in a moment and into the helicopter and on the way back down to Melbourne to get you checked out. The damage to Bruce's motorbike is actually quite minimal, which increases my concern because if his bike hasn't been damaged all that much, that means that Bruce has essentially copped most of the impact from the other bike coming the opposite direction. So we're going to roll you onto your back, mate. A little bit of discomfort as we do that. Ready, set and go. That apprehension and that pain that you must feel as that big chunk of metal and steel actually ploughs into you must be immense.
Bruce's longtime mate Jeff was riding behind him and witnessed the near-fatal impact.
There was a slight bend and there was this bike just coming straight for Simo.
We'll just grab a few sets of hands to lift him.
You can't really believe that's happening. What's he doing? And bang, straight into him. He hit it with such force that it exploded like there was a grenade inside it. I couldn't believe it.
Nice, Simo.
Thanks, Jeffrey. Lots of love and support from your mates.
Oh, yeah, mate.
20 years I've known Simo. This is not the first time I've seen this happen. Actually, I've lost a couple of mates who died at the scene. Then I realised Simo's in trouble.
So a little bit of discomfort and pressure as I put this on.
Bruce has already been given pain relief, so flight paramedic Matt can start his examination and find out just how much damage the massive motorcycle impact has done.
Bruce, give your toes a wiggle. How's your sensation in your feet, mate? At the moment when I assess Bruce, I can't see any obvious deformities or any obvious fractures occurring. A couple of big breaths for me there, Bruce. But that doesn't mean that he hasn't got things underlying that I can't actually see just by looking at him. So there could be internal bleeding, he could have cracked ribs, so we need to transport him to the Royal Melbourne Hospital.
You right?
Okay, are we all ready?
Yeah.
Right, let's hit number one, yep.
High up on a rooftop hotel, Nat and Leonard have just finished splinting Michelle's horrendous leg fracture.
Once we get up high enough, we're going to get the stair chair right across in here and then get her to shuffle across it, all right?
The mother of 2 special needs kids was having a rare night away with her partner Nate when she fell in the pool with disastrous consequences.
Michelle, open your eyes. Can you see me? Hello. You're good.
A second paramedic team has been called in as backup to help move Michelle to the ambulance 19 floors below.
Right, push down on your good leg and move that bottom over. Yes?
Well done, well done.
Oh, amazing.
Unbelievable
Put
job.
the good leg up. Awesome. No? Okay.
If you've got the pancake
there.
breathing, where's that green?
Here we
Where's
go.
the
Pop it in your
methoxy?
mouth. Leonard, let's start rolling forward a bit.
Yep.
We're used to going to traumatic jobs and seeing blood and guts.
Gonna be a bit bumpy, Michelle.
But something about a broken leg moving like this, it just makes me cringe. We're doing one more movement and that's it, and then you're done. You're gonna push down on the good leg and move your bottom over. Yes.
Well done.
Okay, good leg up. Excellent.
Absolute
Done.
champion.
Okay. Whew, we got there.
Nat and Leonard can now take Michelle to the ambulance and start heading to hospital where she'll need urgent surgery.
I'm worried Michelle has broken both the bones in her lower leg. There's potential internal bleeding going on, and has she cut off blood supply to her foot? Oh, it's bad. How you going there, Michelle? You're a trooper.
Gonna be a bit bumpy again, Bruce. He is sore on the right sides.
Motorcycle accident victim Bruce is about to be emergency airlifted 180 kilometres to the Royal Melbourne Hospital.
Bruce, just as we did before, mate, we're going to roll you on your side in just a tick.
The off-duty firefighter was on holidays with friends when he collided with another motorbike.
On go, ready, set, and go. And back, ready, set, and go. Much pain when you do that, mate?
No.
When Bruce tells me he's not feeling any pain, I imagine the impact and how sore he must really be feeling down that side. And I know he's lying to me. Small bumps as we get you in here, mate.
You right, Brucey? Yep.
Good man. Bruce, how's that pain going at the moment now you're resting there?
Oh, yeah.
You feel it, don't you?
I feel it.
Yeah. And no past medical history. You don't take any medicines. You got no allergies. Normally fit, well and active for a man of your age.
Try to be.
Yeah.
He's only 50.
60.
60, eh?
No, 59.
59, don't make me...
Yeah, sorry, I'm not going to make him 60 yet.
Still on the good side.
I've got my 50th this year, so...
Oh, that's not a bad one.
Yeah, I'm planning to have a few lagers on that night.
You've done it hard. I thought you were only 40.
Thanks, mate.
Lived his life down the gravel road.
Turning 50, I look at it and I go, how the hell and where did all those years go? Like, I remember joining the ambulance service at around 28 years of age and always looking up to the senior people thinking, gosh, they've been in the job a long time. And all of a sudden, here I am as a 22-year veteran in the job, turning 50 years of age.
Clear. Up we come.
I'd never change my mind about my career. I have the best job in the world. I work with some of the most amazing, caring and passionate people that you could ever come across. Every day that I go to work, I do something different.
Bruce, can you hear me okay? Good man. Pain still okay? Comfortable, nice and sleepy?
I enjoy looking after people and providing care to them. I wouldn't change anything about it. 50's the new 20.
Just going to have a scan of your belly, okay? Bruce, take a big breath for me. Excellent. No worries now. Good man.
Ultimately, the ultrasound will give us an indication whether there's been any internal bleeding, whether any of his organs have taken an impact. He has a large potential to have injury to his liver or to his kidneys.
Bruce, I'm just going to move your arm just out the way just for a tick, mate. So we can get to your side here. That looks good.
So far, Bruce does not appear to have any life-threatening internal bleeding, but he will be fully investigated at the trauma centre.
You there, Bruce? Good man, mate. But just as we come into land, there's a bit of vibration that goes through the aircraft. That is normal, okay?
Given the accident that Bruce has been involved in, every part of his body is going to be sore and he's going to be feeling every single bump that we go over.
And 5's not the Pat Royal Melbourne Hospital.
That's it. Nice and breezy up there for you, Bruce.
It's all right, mate.
You've come out of it very well, Bruce. That's the main
I
thing.
think I'm very lucky, mate.
Bruce is just a perfect patient. He's a very stoic man. But although he doesn't display a lot of things at the moment, bruises don't turn purple and blue straight away. They take a couple of days to develop. And I imagine in 2 days' time, Bruce is going to be quite colourful down the right-hand side of the body. More than likely that he's got a couple of broken ribs or maybe a broken bone down that side of his body as well.
That's the worst of it, Bruce.
Good on you, doctor.
I'm heartbroken.
Heartbroken?
We went up on our drinks to have on the balcony later. It would have been so lovely.
As dusk starts to fall over Melbourne, reality is beginning to sink in for mum of two, Michelle.
Well done.
Well done.
Deep breath.
Well done. Well done.
Oh.
Gonna lie down.
The 38-year-old mum has just broken her leg in a hotel swimming pool.
Leonard, are you good to go?
I'm happy to slowly roll off.
Luckily, we're close.
So you've got 2 kids that you said. How old are they?
8 and 11.
8 and 11, and both are special needs?
Yes.
Oh, wow. So you really are super mum.
They call me Wonder Woman.
No doubt. I mean, I've got 1 kid, and hats off to, anyone who's got more than that. And you've got 2 kids who need that a little bit of extra help.
Absolutely, yeah.
Well, she's got the red bathers as well.
Yeah.
That's what Wonder Woman wears,
Yes,
isn't it?
She wears red.
Michelle's done such a wonderful job, and I can see that she's got a Wonder Woman tattoo, and she's certainly been one of those today.
We are here.
It was a short trip.
I hate that it happened like this.
You're Wonder Woman. You're going to get over this.
Absolutely.
Now we're at hospital, she'll go straight in and likely end up in surgery today.
We're just going to lower the stretcher.
Okay. We are at hospital. Look at that.
This is not just a fracture. This broken bone is going to impact Michelle significantly. She's going to have a really long recovery time. She's going to have to go through rehabilitation. It's a long road ahead, and she's going to need all the help that she can get.
What a job. I mean, that just took forever, didn't it?
Yeah, that was epic. Poor thing, when she moved her leg, you could see that the foot, it looked like it wasn't even attached.
No, you could feel her pain.
Oh, agony.
What about that view? Did you take a second to take it in? Just
I
a
did.
split second?
I had a look at the view, I checked out the infinity pool,
Yeah.
and then my focus was completely on Michelle.
I looked at the view, thought it was beautiful, and I got a little bit scared as well because I've got a bit of a thing with heights.
So do I.
Yeah,
So do I.
Yeah.
And we were up high, weren't we?
Very.
I know. It was like, don't look down, don't look down, don't look down. Can you imagine? The 2 of us are like, can't do it, can't do it.
Yeah.
Too scared.
Oh, it was a good job.
Leo, you're okay, mate.
It's been 4 weeks since little Leo was attacked by a German Shepherd at a playground.
Got abrasion here, puncture wound there.
The 5-year-old was traumatised and at hospital had to undergo major surgery and skin grafts to repair the damage.
It's okay. It's okay.
Leo's parents have contacted the local council about the frightening incident, but it appears the owner of the dog gave fake details and cannot be found.
Mum is right here.
How are you feeling, Mary?
Tests confirmed 83-year-old Sister Mary was suffering a serious urinary tract infection. She was treated in hospital with antibiotics and has made a full recovery.
Beautiful.
Where are you sore at the moment, Bruce?
It's like I've just had a massive football corky right down the side.
Firefighter Bruce was on a holiday with mates when another motorbike crashed into him doing 60 kilometres per hour.
How's that pain going with that movement and stuff at the moment?
I actually don't want to move my leg.
Righto.
The 59-year-old was off work for a month, suffering cracked ribs and nerve damage down his right side.
How's your leg going?
Oh, same, mate. It's on the mend, though.
Today, his riding buddy Jeff, who witnessed the near-fatal collision, is checking up on Bruce's recovery.
Limping a bit still?
Yeah, I have a bit of trouble sort of bearing weight on it a lot. At the time, there's a lot of bravado and I'm fine, it's all good, but you actually start to think about it about a week later, what could have been. I didn't realise I actually copped it right in the face.
That's where you've hit the ground first. Your head's gone crack onto the ground.
Yeah.
And then this wasn't down, you would have worn your face on the road.
Pays to have something that protects you, doesn't it?
Oh, mate.
There was a stage there where it would be every 5 minutes I'd be thinking about the process of what took place, having visions of the bike coming towards me and having memories of actually bouncing along the road. Yeah, look, I don't know when I'm going to get back on the bike.
Oh, soon?
I hope so.
Oh, mate. Soon, you've got to do it soon.
It's certainly one of the biggest scares I've had in my life. I consider myself extremely lucky not to have any other major injuries.
It's good therapy for you to ride the bike.
Well, I think
Absolutely.
I need to, yeah, eventually.
Meanwhile, the other rider in the collision has been fined for failing to keep left.
How bad's the pain?
Oh my gosh. 10?
10?
10 out of 10.
Yeah.
38-year-old Michelle's romantic night at a hotel with her partner Nate was ruined after a disastrous fall in the rooftop pool.
Well done. Well done.
Deep breath.
Well done. Well done.
Oh.
And lie down.
At hospital, doctors discovered her right leg was broken in 4 places. A metal rod was inserted and Michelle couldn't walk or drive for 6 weeks.
My life revolves around my children, Kiana and Caden. They both have been diagnosed with autism. I was very worried that my accident would hinder the needs of my kids. How am I going to be getting them to school? How am I going to be taking them to their therapies? When they first seen my broken leg, Caden, the older one, he just burst into tears and he started panicking, and it was pretty much a meltdown moment for him. Since that, I've focused on turning it into a positive and saying, no, we're going to learn from this. We're going to see how quickly I can get back on my feet, and I've kind of taught him that, you know, a little bit of resilience.
Yes.
Well done.
Okay, good leg up. Excellent.
Absolute
Done.
champion.
I am so thankful to those paramedics who attended on the day. They were so attentive and they were just so lovely to have by my side in one of the worst moments of my life.
An SOS is coming in for a car that has crashed down a steep hill in rugged bushland with 4 people and a dog on board.
And you said the car's gone over the bank.
2 of them had come out of the car and climbed up. One is covered in blood over his head, and I think the girl was just pretty shaken.
It's a rollover, apparently. Down in Embankment.
Flight paramedic Ray and an air ambulance team are now heading to the crash site in the high country, 180 kilometres from Melbourne.
Someone's still trapped in it. Someone's still trapped.
Roger. M5.
As we go to this incident, we're hearing just how steep this terrain is and just how far this car has rolled down.
Cabin is secure. Stand by. Must caution opening right rear. Roger.
You cannot help but think some serious injuries are occurring, if not death.
Okay, Ray, right 1 o'clock, about 800 metres. I've got some vehicles. Yep, okay, I can see it.
Does that look like it?
Yep, that's it. Yep, target side.
Found it?
Yep, I found it.
The car has ended up in terrain that is impossible for the helicopter to access.
It's middle of nowhere.
They've got a possible landing site approximately a 10 to 15 minute drive from the site.
Yeah, Roger, received that.
We're going to have to land a significant distance away, knowing that there's someone trapped and potentially time critical.
4, 3, 2, mains coming on. Yeah, and ground to firmness.
A local road ambulance crew takes the flight team to the crash site, 10 kilometres away.
All right, we'll just leave everything in here and then go from there. So someone's stuck down there?
The car's almost out of eyesight, 100 or so metres down this slope. I'm thinking, you can't survive such a rollover.
Facing an almost vertical descent, Ray commandeers a fire hose to abseil down to the smashed car.
How you doing?
Jason the patient, Jason the paramedic.
Jason and Jason.
Local paramedics are on scene and have begun treating the driver.
He's extricated himself, got a compound right arm.
43-year-old Jason has a badly broken arm and has lost a lot of blood.
G'day, mate. How you doing?
Really well.
The paramedics have done a really incredible job. They've ascertained that Jason has a significant bleed to his arm and they've applied a tourniquet. And they've done all the right things in terms of managing his pain. But that this man is alive, that he's talking to us, is a miracle.
Incredibly, the 3 passengers in the car have all managed to get out of the wreck and go for help. Jason's daughter Caitlin and son Ethan have escaped with minor injuries. The other passenger is Jason's best mate Eric, and he's already been taken to hospital with a massive cut to his head. But now, Ray needs to get Jason out, and it's going to be a logistical nightmare.
I look up and I can barely see the sky.
There's no option to winch from here. There's too many trees around. The tree canopy's just too thick.
5, go ahead.
5, if you could pass on to the flight crew, this won't be a winch, but a protracted extrication.
With no way to winch Jason directly into the helicopter, the rescue operation could take hours, dramatically increasing the risk to his life.
A prolonged scene like this always causes concerns. Has he got underlying internal injuries? That's the time bomb. We're waiting for it to go off.
Male's fallen through a skylight, a 2 to 3 metre fall. He's conscious and breathing. He's at a community health centre.
Back in Melbourne, Mike and Eamon are on their way to a Code 1 call. A young boy has fallen 3 metres through a skylight.
Falling 3 metres isn't a small fall, is it?
At his age, 10 to 11-year-old, 3 times his height.
Immediately, you think the worst. Has he landed on his head? Has he broken limbs or even his spine? There's huge potential for massive trauma.
Yeah, traffic's fairly heavy.
Move left, left.
Finally, the team arrive at the community centre, fearing the worst.
Hey, mate, do you know where we're going?
I can feel my stress levels rising. I don't know what I'm about to walk in on.
Mate, are you the one we're here to see? No way, what's your name?
Cooper.
Cooper? You're looking very well for a young bloke that's fallen through a roof.
Thank you.
So I walk in looking for the sick and injured child mangled on the ground. Lo and behold, there he is sitting up quite happily on a chair.
What happened?
So I was getting my friend's footy,
Yeah.
and then I felt it in the sky.
And what did you land on?
Just the ground.
What part of your body landed on the ground?
I just landed perfect down my feet.
So you just landed on your feet, and then have you sort of fallen to the ground a little bit?
To have landed the way he did, it's perfectly Olympian style. He's pretty much Cooper the cat.
How'd you end up with the graze on your arm?
When the light broke, it grazed on it.
I'm looking at this kid and thinking, how is this possible? How are you sitting up here talking to me with barely a scratch after falling 3 metres through the air? He's some sort of Houdini.
So you haven't hit your head or anything like that?
No.
No. So you haven't lost consciousness or anything wild like that?
Although Cooper seems to have had a miraculous escape, Eamon is worried about serious internal or spinal injuries.
We have to be abundantly cautious and get him up to hospital for a review by the doctors and maybe some scans as well.
The hospital just needs to observe you for a few hours to make sure you stay the way you are. Not every day you fall through a roof.
While Eamon continues to marvel at Cooper's great escape,
The largest watermelon is 158 kilograms.
158?
Steve is marvelling at his partner Emily's amazing knowledge of the humble watermelon.
How do you even eat that?
Well, you wouldn't. You just scoop a hole out
And
then
swim
I would
in it.
bathe in it. Yes!
I love Emily. It's very rare that you are able to meet someone in your life, and especially at work, that you can literally just be yourself 100% around. Emily is special. She's a very special person.
I love how you've been Googling watermelon facts.
But the fun facts are finished. A Code 1 call has come in for an elderly man in trouble.
We are going to
Yeah?
the 82-year-old male. He sounded confused.
Okay.
Vision problems while driving. Has just been to doctors who advised the patient he's got an elevated heart rate and to drive to the hospital.
Okay.
All right.
Steve and I just sort of look at each other, go, well, hang on. It says that he was just at the doctor's. If the doctor understands that he's got a fast heart rate, why is the patient now on the side of the road in his own vehicle?
Do you reckon it's this man here?
Yeah. Oh, look.
Thanks for coming, fellas.
Fellas, I'm a lady. Hello, nice to meet you. I'm Emily. This is Steve.
Hello.
Steve, hello.
What's your name?
Gordon.
Nice to meet you, Gordon.
I do have a special soft spot for the elderly. They make you just feel like a friend. It's so beautiful. Standing face to face with Gordon, I can see that he is unwell, that he had a really unsteady gait, and the alarm bell started ringing.
How are you feeling on your feet? Fighting fit?
Wish to goodness I was.
All right, up onto the bed, okay?
The doctor said that my heart's beating 3 times quicker than what it's normal. What it should be done.
Gordon tells me that the doctor has told him that his heart rate's going 3 times the normal limit. And I just look at Steve and go, what?
What did he tell you exactly?
He wanted me to go to hospital.
Right, and he told you to drive?
No, he asked me, was I okay to drive, and I volunteered. I said, yeah, I'll get there.
Okay.
And I got lost.
He could have crashed, injuring someone else or himself. Thank God he was able to pull over and get the care that he needed.
Do you feel like your heart is racing at the moment?
Yes.
Okay.
My fly's undone.
Steve's fly's undone. He's showing.
Yeah.
I'm sorry,
He's showing
Gordon.
us everything.
I'm trying to keep Gordon really calm and relaxed. I look up and see Steve's fly is undone. Right there in full frontal view, fly undone. And this isn't the first time that Steve's done this to me.
Oh, in those tight pants, I can already see everything.
Em just wants to pick on me and stir me up, which she did. Thank you, darling. Thanks for telling me something that has made me very embarrassed.
Em, this looks like VT.
Okay.
The mood changes dramatically when Gordon's ECG records show just how much trouble he's in.
We'll get Micah.
Get me micro and a code 1, please.
He's looking at the printout that the doctor gave. Gordon could go into cardiac arrest at any moment.
Okay, so what's happening?
Can we please have Micah for a code 1 for an 80-year-old?
Your heart, it's in a rhythm called ventricular tachycardia.
He's conscious at the moment.
Steve makes an urgent call for intensive care backup.
Have you ever gone into this rhythm before?
No.
No.
Right now, I am worried that we could potentially lose Gordon at any time.
Skin and blood pressure now, but heart rate's 160.
What's going on, Jason?
Back in Victoria's high country, flight paramedic Ray needs to get badly injured crash victim Jason up a steep hill to safety.
Just going to take a protracted rescue because obviously the scene is quite a long way down. It's going to be quite difficult to get up. He's got some arm injuries, so maybe a dislocated shoulder and a bit of an open fracture around his elbow.
Jason is the driver of the car that hurtled 100 metres over the edge, towing a trailer load of dirt bikes. Amazingly, Jason's 18-year-old daughter, Caitlin, and 20-year-old son, Ethan, escaped serious injury.
I look around and I hear Dad saying, "We're f***." I felt like that could have just been the end.
It was terrifying. After about the 9th roll, the trailer snapped off. We spun around and started going head to tail. I remember thinking nobody could survive this and sort of felt like everybody else was already dead.
How's that bleed looking? Nothing oozing out?
When the car finally came to rest, Jason's children bravely sprung into action. Caitlin put a tourniquet on her father's arm to stop the dangerous bleeding, while Ethan climbed 100 metres up to the road to get help.
They've been through both the horror, the emotional terror of this accident, but still the presence of mind to attend to his injuries and then get up and out to try to attract help. Those kids have saved his life.
Where are my keys to?
Listen, somebody will sort out where they are.
Jason urgently needs to get to hospital, but the dense tree cover has ruled out winching him directly into the air ambulance.
Can't get him up out of here. No.
A specialist rescue team is now on its way, but there's a major issue that just can't wait.
Just worried about the car being unstable. The paramedics here have requested that the car be secured.
Before you move him.
This is an incredibly dangerous scene. It's as hazardous as anything that we go into as paramedics.
There was noises and grunting from the car.
Yeah. At any given moment, whatever's holding this car up can let go. I don't want it coming toppling down on all of us and basically creating another 5 or 6 patients.
As Ray waits for the crash scene to be made safe.
So your mates kicked the footy on the roof?
No, I kicked the footy on the roof and then I went to go get it.
Back in Melbourne, Eamon's assessing 12-year-old Cooper after he crashed through a skylight.
So you've kicked the footy on the roof, you've gone, hang on, I better go get that. Climbed up on the roof and then you've come through here.
I get where Cooper's coming from. I'd want to get my footy back too. But climbing 3 metres up onto a roof and walking onto a skylight, he may never have been able to kick a footy again.
When you fall that far, there's a lot of force that goes up through your feet, up through your legs and up through your spine, but it may have done some damage to your back. So, because you've fallen so far, you have to go to hospital. How do you reckon Mum and Dad are going to take it?
I don't know.
You reckon they'll be pretty good about it? Yeah.
I think Cooper's going to cop a spray from Mum tonight.
Just going for a quick trip.
But before Cooper is taken to the ambulance...
Here, do you want to stay with the young fella? I'm going to go have a look at your bloody efforts, mate.
It's good. 10 points for landing. You see the shattered there. There's nothing too sharp.
Eamon wants to check out the scene of the Great Escape.
All right. He's cleaned that up. He's so lucky. I mean, if he hits his head on that tap, I mean, if one of these shards gave him a laceration and he hit a major artery, he'd be in all sorts of trouble. Keep looking straight, mate. I don't want you twisting your neck, all right?
Cooper might look okay now, but it is possible Cooper's got a spinal injury, so we really need to get him out into the ambulance so that we can fully assess him.
You're getting the deluxe package. We're rolling out the red carpet treatment for you, OK?
These pads on your chest, if anything goes wrong, we're able to shock you back into a normal sinus, hopefully, back in your heart.
I hope so.
Yeah, I'll look after you, I promise, OK?
Emily and Steve are treating 82-year-old Gordon for an accelerated heart rate that could prove fatal.
Ventricular tachycardia, also known as VT, is a life-threatening arrhythmia. If you don't revert someone out of this rhythm, it can kill you.
Gordon, how do you feel in yourself?
I'd say embarrassed.
Apart from being embarrassed, which you should not, this is a medical emergency.
I got no strength in my legs.
I don't think he understands how sick he actually is. He was so apologetic that he had called us and that he had inconvenienced us. Such a beautiful human being.
Gordon, and take good care of you, my love, OK? What's wrong, love?
Where am I going?
We're going to go to hospital.
At this point in time, I am picturing the worst-case scenario going through my head. Gordon is about to fall into cardiac arrest. I'm literally planning in my head how we're going to resuscitate him.
So, this is Gordon.
Hey, Gordon.
An intensive care paramedic has now arrived to take over Gordon's primary care.
Has this ever happened before? You've had a fast heart rate?
He has had ventricular tachycardia before.
He has had it. Have a quick look from there. We'll start sorting stuff out. Do you want to go with the infusion pump out, Steve?
Yep.
Big breath. So, Gordon, your heart's going incredibly fast at the moment, OK?
So they tell me.
Because Gordon's condition is life-threatening, a second intensive care paramedic has been called in.
So, look, I've just printed off an ECG. Apparently, he's got a history of VT and cardiomyopathy.
This is far less regular here.
Yeah.
Gordon, you all right? It's Emily, love.
Yeah,
Good. You look a bit confused. Are you OK?
I got the experts around me.
All right, so essentially at the moment you're debating between you.
It's a lot of jargon, isn't it?
I can see Gordon getting overwhelmed with everything that's happening. I reassure him, I'm still here, I'm not going anywhere, and we really care about what's happening with you today.
Do you want a little bit of oxygen, given he's been going at that rate for that period of time?
Yeah, we've got some traumas on.
His heart is in a rhythm and a rate that he cannot sustain for much longer.
We're going to give you a medication to try and slow your heart rate down, OK?
Oh, that's a must.
There's only a matter of time that you can be in this heart rhythm before you go into cardiac arrest.
Oh, g'day. My name's Michael Fox. I'm calling from Ambulance Victoria. I'm a paramedic. How are you?
Mike and Eamon are phoning Cooper's mum after her 12-year-old son crashed through a skylight and fell 3 metres.
He's in the ambulance with us now. He's OK. We will be taking him to the Royal Children's Hospital.
The call came through. It was no caller ID, and I answered it because I knew it would be something about Cooper.
He's all right. He's just got a few scrapes. Can you just talk to your mum for me, mate?
Hello.
Hi, darling. What happened, sweetheart?
I fell through a skylight.
What were you doing up near a skylight?
Getting a footy.
Oh. Right, OK.
Julie's incredibly relaxed. I know if this was my mum and I was in that situation, she'd be blowing a gasket.
What are you mainly checking for? Like spinal stuff?
That is a concern.
Other than being born, we've had 7 or 8 hospital visits. Broken bones in his arm, the typical monkey bar one at school, broken bones in his foot at the skate park. We sort of know how the ambulance and the hospital system works.
Thrill seeker Cooper is Julie and her husband Fraser's only child together. Right from the start, he was performing small miracles.
We started going down the IVF track. My husband and I were really quite surprised to hear that we had between a 1 and a 1.5% chance of falling pregnant. So he's really precious. Just love him. We call him Super Duper Cooper.
We'll be at the hospital with Cooper until you arrive, I'd say.
Thank you so much.
Thanks, Julie. We'll see you then.
Bye.
Bye.
You all good, mate? Yeah. Any pain there, mate?
No.
It's important to keep reassessing Cooper because I just can't believe that he doesn't have any injuries. I check him from head to toe. I feel up and down his legs. I check his hips. I check his stomach. I check his chest. I check his spine, and I just can't find any serious injuries. I'm blown away that there's nothing else going on here. Cooper is definitely one of the luckiest kids I've come across. Not many kids fall 3 metres and bounce onto their feet.
You've won yourself one of these beautiful collars. So these things are great, mate, because they make you look sicker and you get more sympathy.
And you'll get to take it home and show all your mates. Perfect.
Let's go.
All right.
We've been here long enough.
So Cooper's been putting on such a brave face, and I know he's reliving that moment and he's thinking this could have been the difference between life and death or ever walking again.
Need one on the rear, one on each side.
In Victoria's high country, a specialist team is preparing for a dangerous rescue after a car crashed 100 metres down an embankment.
We're going to bump that shoulder a bit getting up, unfortunately.
The driver of the smashed vehicle, Jason, is out of the car and sitting up, but he has a badly fractured arm and is still in danger from serious blood loss. Jason may also have a dislocated collarbone, making it difficult to fit a precautionary neck brace without causing him more pain.
In this case, we just need to check that IV, that's all.
Flight paramedic Ray urgently needs to get him to the helicopter to airlift him to hospital.
If you've got to get surgery on that arm, you're probably a couple of days in Melbourne.
But before Jason can be moved, the emergency services first need to secure the overturned vehicle before it slides down the hill on top of the rescue party.
I'm absolutely worried. I am worried that all of us are going to get hurt and that at any given moment, whatever's holding this car up can let go.
We're just waiting for the SES to stabilise the car so the car doesn't tip down any further.
But as the team begin working on the car, Jason starts shouting for help for the 5th occupant of the crushed vehicle. His best mate's dog, Bruce.
I don't know where the dog is. Can you just ask if Bruce, the dog's up there?
Bruce faithfully stayed by Jason's side after the traumatic crash.
He was out of the car before. He's just climbed back in.
Yeah.
He wasn't going to leave.
Jason doesn't want the dangerous task of securing the car to go ahead until his mate's dog is found.
Let's have to make sure the dog's not in the car before we pull it up.
So we don't know if Bruce is alive or dead. I'm actually expecting the dog to probably have died.
But suddenly, there's a message from rescue headquarters at the top of the hill.
Hey, fella. How are you? Hey.
The loyal dog has been found alive.
Has Bruce stayed down there the whole time, has he?
Yeah.
Good boy.
A few minutes later, and another breakthrough. The car has been secured, and that means it's safe to start moving Jason to the ambulance.
You ready? Yep. 3, 2, 1, stand.
But the rescue is going to be challenging.
If Jason's got a dislocated shoulder or an apparent spinal injury, then the complications of moving him are significantly increased. And remember, we're on a slope like that.
Pipeline on rescue. We'll load the system.
All right. We don't want to lose him down the hill. We don't want to add to his injury. So if he can move on his own steam, we've only got to get over this log, get him into a basket, and we're getting secured. Then that's the preferred method.
Okay.
Yeah, I'm just waiting for you.
Yeah, okay, mate. You're good. All right. Now, I need you to stand yourself up. Just wiggle that over. We got time, mate, all right? We've got time, and I don't want you falling off anything. Okay, mate. Okay, I've got it. Straighten up a bit for me. One more shuffle back, mate, and you can park your bum in that stretcher. That's it.
Good job.
Good man.
Getting him up and moving into the basket is an enormous relief. We're ready to go.
Ready for up? Up right! Up right!
Yep.
Okay, keep going straight through, guys. You want to go straight up to the road if you can.
4 hours after the crash,
All the way to the road.
Jason is finally carried from the wreckage of his car to safety.
Swing around to your right a bit if you can, guys. Get him level. Down. Good work.
Don't know how well he is, though. He's alive. Jace, have you looked at photos of what you've been?
No, mate.
It's just stunning. It's stunning. You've just got a broken arm, really. You're a lucky man.
Like I said to this bloke, I think I've been kissed by an angel.
I think the Angels had a group kiss there because there's actually everyone's up, everyone's talking, and everyone's out. It's just stunning.
We'll get you out of this. It's pretty easy. Pop you on a stretcher. Yeah. We'll head on down, probably about 10, 15 minutes away from the chopper.
Yeah.
Then into Melbourne, okay?
This job isn't over. Jason's had a significant injury still. He's bled a lot, and he really does need to get to a major hospital straight away.
Ready, set, lift. Okay, mate. Okay. You feel your heart racing.
Yeah, I feel it.
You feel a bit out of sorts, but no pain anywhere or anything like that.
Back in the city, 82-year-old Gordon is clinging to life as his heart beats at almost 3 times the normal
You're
rate.
feeling your heart skip a beat, are you? Every now and then.
Mobile intensive care paramedics were called in as soon as Emily and Steve realised Gordon was in a critical condition.
Bumps on the road.
I'm driving really fast, safely but fast, because I know that he has the potential to deteriorate so rapidly. He can die at any moment.
Gordon, the medications that you're presently on, are you taking any of those on a daily basis?
I've got to be quite honest with you, madam. I haven't taken any medication for 12 months. COVID thing.
It's become a huge concern that people aren't taking their medications or haven't been regularly seeing a doctor because they'd been too scared that they would contract the virus.
That's sitting at a rate of about 110 now. And there it goes fast again. Yeah.
And you're still feeling okay, are you? Yeah. It's fantastic.
You all right, Gordon?
Yeah, going okay.
How was my driving?
23 out of 10.
23 out of 10. You spoil me.
Wheeling Gordon into the hospital, I can sense that he feels really vulnerable.
Gordon?
Yes.
You all right? Everyone's hovering around you.
The fight to save Gordon's life is now in the hands of the emergency team at the Alfred Hospital.
We hand over to the medical staff, but I'm still worried that Gordon could potentially pass away from this event.
There's a lot going on. I get it. You're probably freaking out.
Yeah.
It's understandable to be freaked out. Okay?
Mike and Eamon are on their way to the Royal Children's Hospital with Lucky Cooper.
So are you in year 7?
Yeah.
The 12-year-old fell 3 metres through a skylight and, incredibly, doesn't appear to have suffered any major injuries.
It's got to be scary. He's only 12, you know. He's all by himself. So it's our job to make him feel really safe.
Do you like school?
Yeah, it's pretty good.
That's good. We don't often get that answer.
I just don't like maths.
Yeah, me either.
You don't get maths nerds like me climbing on the roof.
Nah, yeah. Foxy was a maths nerd.
Yeah.
And all I hear from the front of the truck was Mike going, I love maths. No surprises, Foxy.
Got any good jokes?
No.
Did you know falling's actually not that dangerous?
Really?
Yeah, it's hitting the ground that's really bad.
Eamon's sense of humour.
What did the fish say when it swam into a wall?
What?
Damn. Damn it. I thought those jokes are funny.
I'm sure you did. All right, here we are. The bed's gonna come out, it makes a bit of noise. Here we go. How do you rate the in-drive entertainment?
Good.
Good?
See, told you I was funny.
Oh, no.
Cooper's a lovely kid, and he's definitely one of the luckiest kids I've come across. He's got a real great story to tell his mates now.
It's all right, maybe you should spend more time working on your jokes.
How are the wedding plans coming along, Marley?
Back in the city, a new paramedic partnership is just beginning. It's the very first shift together for working mother of four Taney and soon-to-be married Marley.
We are eloping in 4 weeks and 3 days.
Oh my gosh, how exciting!
Yeah.
I have had to postpone my wedding quite a few times. I actually don't know the exact number anymore.
We just got sick of rescheduling our overseas wedding. It was getting a bit challenging. We were sick of waiting.
Marley's nuptials have been one of the many casualties of COVID-19, with wedding numbers restricted and overseas travel banned.
And with the prospect with COVID that maybe we won't be able to travel this year as well, we thought we'd just elope in Byron Bay.
I'm not the classic bridezilla, but I just want to get it done, you know, like, girls got to get married.
We've got a case that's come in saying the patient's unconscious.
Support 213 received code 1.
Talk of weddings and honeymoons is put on hold again, with a call out to an unconscious patient at a nearby railway station.
So this could be a heroin overdose.
Could be a heroin overdose.
Drug overdose on a train.
Railway jobs seem to be drugs, alcohol or mental health. But I'm also concerned that it could be a medical event.
We're on platform 2. We've got a 18-year-old male with a heart rate of 56. We're currently assisting his ventilation.
Another paramedic crew is already treating the teenage patient who can no longer breathe on his own.
He's unconscious and they are having to breathe for him. This patient is significantly unwell.
Hey guys, my name's Marley. This is Taney. What have we got here?
The young man was found unconscious on a train and was moved onto the platform for treatment.
Heart rate of 50. Naloxone 401. Does anyone know him?
Don't know what sort of person would leave their friend unconscious on a train and not breathing and then do a run out. You need to stick around and help your mate out.
All right, shall we get some Narcan then, maybe?
Yeah.
Lacking vital information as to which drug the teen might have taken,
All right, we'll narc him.
Marley decides to administer Narcan, used to treat heroin overdoses.
And his heart rate's quite bratty.
Quite bratty.
He's bradycardic at 30, so someone put pads on.
Suddenly, the patient's heartbeat plummets to a critically low 30.
We're going to do two-handed technique in ventilating.
The paramedics are getting ready for resuscitation.
This patient is deteriorating and we need to act quickly. He definitely could go into cardiac arrest at any point.
You're all right, mate. You're with the ambulance.
Hold on to your arm, buddy. We need to roll.
Hold on to your arm. You're only going to come to me a little bit, okay? Ready, set, roll.
In Victoria's high country, flight paramedic Ray is preparing to airlift road accident victim Jason to a Melbourne trauma hospital. The 43-year-old has a major open fracture to his arm, and he's still in danger after major blood loss.
Where's my son? Where's my daughter?
Hey, son and daughter, they're both okay. They're good.
But Jason is more worried about his kids, Ethan and Caitlin, who were also in the car when it crashed 100 metres down a steep hill.
Ethan, mate, I'm okay, mate. Yeah. It just does look like I've broken my whole arm.
Kids was down there.
And they're going to do surgery on me. I love you, mate, and I'm really, really sorry.
That's all right.
I hope you're okay.
Yeah, I'm fine.
And
People kept telling us that, you know, someone should have died or that none of us should have survived, and the fact that we did was a miracle in itself.
How are you travelling?
Not good.
You feeling anxious?
Yeah.
Okay, so clearly you do a compound fracture, so it's open, and the bone just pokes through, so it bleeds.
Ray's main concern on the 15-minute ride to the helicopter is the compound fracture in Jason's right arm.
And when you pump a bone through your skin, it can take out a blood vessel or nerves on the way through. He has an open fracture. They can be incredibly dangerous. You cut a significant blood vessel, whether it's an artery or vein, you have potential to bleed to death. All right, hang on to that arm.
After 3 hours at the accident scene, Ray finally has Jason in the air ambulance and on his way to the trauma centre at the Alfred Hospital.
M5 airborne now for the Alfred. So 43-year-old gent, he's driver of a car. Look, it's plunged down a pretty steep embankment. Patient actually self-extricating. It's got a compound fracture of his right ulnar radius.
Jason will undergo a full assessment of his injuries and surgery on his fractured arm.
He's going.
Yeah, so you're going to have a cast of stars looking after you, mate.
Tell your story.
If that had been the accident, it probably should have killed some of them. That would have probably been the most difficult job of my career.
Would have been some ride in it. Jeez.
Imagine that. Bang, bang, bang. Jason and his family and Bruce the dog, they're just incredibly lucky. Everyone's incredibly lucky to walk away from this. Nothing short of a miracle.
We're at a rate of 38.
In Melbourne's southeast, paramedics Marley and Taney are still fighting to save the life of an 18-year-old man found unconscious on a train.
36.
Mobile intensive care paramedic Steve has now arrived and is desperately trying to get the teenager to breathe on his own.
Can you count his respiration rate? Yeah.
The only thing that's keeping this patient alive at the moment is us ventilating him. Without that, he has the potential to go into cardiac arrest.
I'm just about to get that Narcan in, guys, so I'm going to have a sharp sound in a second.
The teenager's heart rate is dangerously low, following a suspected heroin overdose.
We're going to give Narcan. It reverses the effects of heroin.
Is that the Narcan going in now?
We are working our butts off, literally, to save this young guy's life.
Someone want to pop that BK cuff back on?
And in amongst all of the chaos, for a fleeting moment, I look down at him and I think, he's so young, so vulnerable. What has put him in this circumstance? He's literally been left for dead on a train. And it's really heartbreaking.
The Narcan went in at 18:44, so that's nearly 10 minutes.
If the patient's critical state has been caused by heroin, the Narcan should be helping him within a few minutes.
36, 35, 34. His rate's 33. He's not improving.
Things have just become really critical. This patient isn't waking up. We're breathing for him again. And now he has a heart rate of 30.
Open your eyes, mate. Open up, buddy.
I'm really concerned that this patient isn't going to make it.
While he's on his side, do you guys want to get him on the board?
You're all right, matey. You're with the ambulance, mate. We've got ya.
Okay, girls.
You're all right. Just want to keep you safe.
1, 2, 3. Excellent. Stand up.
Doing well, mate. Doing well. It's all right.
He's breathing up a bit on his own.
There are times where we have to provide airway support, but then he has periods where he is breathing alone, which is confusing and hard to manage.
Heart rate's at 44.
Yep, cool.
That's at 96.
BP's still good.
Heart rate's not ideal, but not terrible.
Rightio, let's go.
Scoot. Like I can... Come on, mate.
With the trip to hospital only going to take a few minutes, Steve's decided not to insert a breathing tube.
You want that out? Okay.
But emergency doctors will be waiting to put the teenager into an induced coma and continue the fight to save his life.
All right. So what is he, 18?
18.
Young fella.
I always try and think, he's somebody. You know, he's got so much of his life ahead of him, and it's just such a shame that he hasn't realised that yet.
You're all right. You're okay. It's all right, mate. You're okay.
Have you ever gone into this rhythm before?
No.
No.
It's been 4 weeks since 82-year-old Gordon was rushed to hospital with his heart racing dangerously out of control.
You all right, Gordon?
Emily and Steve were worried he wouldn't survive. Fortunately, Gordon is still with us.
Play it again, Sam.
After a week in hospital, he's now back home and looking forward to some special visitors.
Oh, yes, I was frightened, all right. I tried to put on a brave front. I kept thinking about my grandson. I wanted to be around for his 21st birthday.
How are you?
Good.
Nice to see you.
And hello. I look at Gordon and I think you are one lucky man. Someone is on your side looking out for you.
You look great.
Well, I'm keeping you out of trouble. That's the most important thing.
That's the main thing.
I was overjoyed to hear that Gordon made it out of the hospital safely and is still alive. I was just so happy.
I thought it was it.
So did I for a minute there.
Emily was very nice to me. Just saying, stick with it, pal. I'm with you all the way. Couldn't ask for any better care. If I knew you were coming, I'd have baked the cake.
Oh, Gordon.
My luck changed that day. There's no maybe about that.
Thanks for having us.
It's always great to see you.
It's good to see you.
Keep you out of trouble.
I'll try.
And look
Can't
after-
make any
look after
promises.
yourself.
I will, thank you.
Thank you, Gordon.
Thanks
Likewise.
for the cake.
12-year-old Cooper dramatically crashed through a skylight while trying to retrieve a football.
You've done a pretty good job of it.
I remember getting frightened and then everything went in slow motion and then everything just went super fast and I dropped down, landed on my feet and I was surprised. And I just looked at it for a bit and then I went, oh my God.
Cooper escaped with only a few scars and he's back to his thrill-seeker best.
People say you've got to go buy a Tats Lotto ticket. But I said to Cooper, you actually don't need to get a Tats Lotto ticket. You've actually already won the lotto. Like, you're okay. And that was the most important thing. Love you, sweetheart. You're the best.
How you doing? You been better?
Jason lost control of his car and crashed 100 metres down a hill.
Nice, getting level.
He spent 3 days in the Alfred Hospital, where he had surgery on a compound fracture to his right arm.
But inside a pinata to walk away from it, we're pretty lucky.
It will take months before Jason will have full use of his arm, but he's just grateful that he, daughter Caitlin and son Ethan are still alive.
We've flipped 14 times all up down the hill. I thought we were all going to die. So how are you doing, dude?
Good, actually.
Yeah?
Also in the car were Jason's best mate Eric and his dog Bruce.
How do you think, like, how lucky we were?
Scale 1 to a million, about 1.5 million.
How cool were the kids in their accident?
They are absolute legends, those two.
When the car finally stopped rolling, Ethan climbed 100 metres to flag down help, while Caitlin tied a tourniquet around her dad's arm that saved his life.
I've always thought they were amazing. Right? They're the best kids on the planet. Now I know they're the best kids on the planet. You don't really know what you've got until you almost lost it. Whoever you want to believe in, it's like, listen, mate, here you go. This is your next ticket. Don't waste it.